So, for treatment options for wear and tear problems, soft tissue injuries, really the vast majority of them really can be managed non-surgically. The key to non-surgical or to successful management is really early diagnosis. And so things like activity modifications, things as simple as immobilization in boots or removable casts, splints are usually first-line treatments. There are a lot of non-invasive surgical options for patients with these types of injuries as well. And one of the most common is platelet-rich plasma therapy, which is very commonly seen in the literature now and being used on high-performance athletes. This technology uses the patient's own healing factors and stem cells that are usually combined and injected into areas of injured tissue to help stimulate the body's own natural responses to healing. So we gear the number of treatments based on patient response, dose response in other words. So if the patient responds from a single injection for, say, a plantar fasciitis, it may be a single injection. You can go up to 2 or 3. I generally don't go more than that. Generally, if a patient doesn't respond by a second or third round of injection, you have to sort of reassess. Platelet-rich plasma therapy, or PRP therapy, generally requires multiple injections. There are some newer techniques that are coming out using amniotic tissue, which is a kind of emerging field in minimally invasive musculoskeletal medicine. And the initial studies on these have shown single injections to be superior to PRP. So that's sort of an area that is also up and coming. So the success rates are kind of all over the map. There are certain areas where clearly it is effective, things like chronic tendinoses, Achilles tendinopathies, certain ligamentous injuries, chronic overuse syndromes like plantar fasciitis, which is a very common problem that we see, are commonly used or commonly treated modalities for platelet-rich therapy. There really is no hard science, unfortunately, behind it, mainly because the studies regarding this just don't exist. There are a few studies that have shown success in the Achilles tendon per se, but there's not a lot of hard data.